Ever since I was a little kid, I looked up to my heroes. They were strong and powerful. They inspired me, and I wanted to be like them. After years of research, I found the secret I need to be like them. 8-pack abs. And so I trained myself. 100 sit-ups, 100 push-ups, 100 squats, and a 10-kilometer run. Every day, every week, every month, for 3 years. Now, people admire my physique. They praise my diligence. They ask for my autograph. But in the end, I still only have 6-pack abs. They told me that it's enough, but in fact, I am far from enough.
What have I done wrong? Is there something that I missed? Or maybe I was never born for this. Someone tell me what to do.
What should he do? A. Double his routine and work harder. B. Remain the status quo and have faith. C. Take a little break and have fun instead. D. Give up and admit that he's a failure. The correct answer is E. Learn basic human anatomy. Let me break it down for you. Rectus abdominis, the so-called abs, is a pair of muscles. There are 6-pack abs and 8-pack abs because they're segmented by tendinous intersections. Many people have 3 bands, therefore have 6-packs. If you're born with an extra band, then you'll have an 8-pack. To conclude, yes, you are not born for this. How about you stop crying like a baby and learn anatomy like a man?
Okay. So, what is it about anatomy?
Well, let me tell you. Human anatomy is the study of human body structures. We learn all about the body structures you can see with your bare eyes, what they do, where they are, and how they interact. By understanding human anatomy, you will know the normal functions of a human body. For medical personnel, it is crucial to understand anatomy before learning pathology, performing physical examinations, and more. For someone who is just interested in learning anatomy, this study enables the learner to correctly identify bodily functions or dysfunctions, allowing them to improve life quality or seek proper medical attention when required. Now, let's start off our human anatomy journey with some basic terminology. The anatomical position. In anatomy, we describe the position of a human body in the anatomical position. It is when a person stands upright, eyes looking straight forward, arms relaxed down, palm facing forwards, heels close together, and toes pointing forwards. Anatomical planes. In anatomy, we view the human body through imaginary planes. The 3 conventional planes are the sagittal plane, dividing left and right, the coronal plane, dividing dorsal and ventral, and transverse plane, dividing cranial and caudal. Terms of direction. It is important to accurately describe the relative position of an organ. In anatomy, there are specific terms used to describe directions. Anterior or ventral mean the front. Posterior or dorsal mean the back. Superior or cranial mean above. Inferior or caudal mean below. Lateral means toward the side of the body. Medial means toward the middle of the body. Proximal means nearer to the trunk of the body. Distal means away from the trunk of the body. Superficial means closer to the surface of the body. Deep means farther from the surface of the body. Terms of motion. Muscle movements are described with terms of motion. Flexion is a bending movement that decreases the angle of a joint. Extension is a straightening movement that increases the angle of a joint. Abduction is to move a structure away from the midline of the body. Adduction is to move a structure towards the midline of the body. Elevation means moving superiorly. Depression means moving inferiorly. Internal rotation is rotation towards the axis of the body. External rotation is rotation away from the center of the body. These are the basic terms of motion. Now that you learned the terminologies of position and movement, let's talk about the steps in learning anatomy of a desired body section. Number 1. The musculoskeletal system. The musculoskeletal system is the frame of the body and is usually the first thing we describe in anatomy. Bones are the scaffold of the musculoskeletal system. You learn the name of a bone, the structure of the bone, what other bones it joins with, and the ligaments that covers these joints. Muscles move joints as well as protecting and supporting other internal organs. You learn the name of a muscle, the origin and insertion of it, and what direction it moves the body. Number 2. Organs of other systems. There are many organ systems in our bodies, usually gathered in the trunk. We discussed the cardiovascular system, the respiratory system, the gastrointestinal system, the urinary system, and the reproductive system. The nervous system is independently described in neuroanatomy. You need to learn the names of all of these organs, the morphology of them, where they situate in the body, and what their functions are. Number 3. Blood supply and innervation. All organs in the body require blood supply and innervation for their survival and function. It may be complex, but its importance cannot be overstated. For blood supply, you need to know the names of any visible vessel, what organs they supply, where these vessels are in our bodies, and the branching relationships of each of these vessels. For innervation, you need to know the name of any visible nerve, what organs they innervate, where these nerves are in our bodies, and the branching relationships of each of these nerves. Now that you know how to learn anatomy, let's do some practice, shall we? Starting off with something simple. Let's discuss the arm. The arm is simple because, well, there is no organ system involved. There is only one bone in the arm, that is the humerus. It connects the scapula with the glenohumeral joint, connects the radius with the humeral-radial joint, and connects the ulnar with the humeral-ulnar joint. The humerus can be divided into the upper extremity, the shaft, and the lower extremity. The structures on them are too detailed to be covered in this video. On the anterior side of the arm, we can see three muscles: coracobrachialis, biceps brachii, and brachialis. The coracobrachialis originates from the coracoid process of scapula and inserts to the anterior medial surface of humerus. It flexes and adducts the glenohumeral joint. The short head of biceps originates from the coracoid process of the scapula. The long head of biceps originates from the supraglenoid tubercle. They merge and insert to the radial tuberosity and the bicipital aponeurosis. It functions to flex the elbow joint when the forearm is supinated. The brachialis originates from the anterior surface of the humerus and inserts to the coronoid process and the tuberosity of ulna. It functions to flex the elbow joint. On the posterior side of the arm, we can see triceps brachii and anconeus. The long head of triceps originates from the infraglenal tubercle of scapula, the lateral head from above the radial groove, and the medial head from below the radial groove. They insert to the acromion process of ulna. It functions to extend the elbow joint. The blood supply of arm comes from the axillary artery. It has a lot of branches, but we're not here to destroy your confidence. Just remember that it enters the arm as the brachial artery. It runs down the arm from the medial side to the ventral side. The brachial artery has 3 small branches from the arm. The main vessel branches into the radial and ulnar arteries in the forearm. 5 major nerves are present in the arm. They are the axillary nerve, the musculocutaneous nerve, the radial nerve, the median nerve, and the ulnar nerve. They originate from the brachial plexus. Again, we're not here to destroy your confidence. The axillary nerve innervates the deltoid. The musculocutaneous nerve innervates the coracobrachialis, biceps brachii, and brachialis. The radial nerve innervates triceps brachii, anconeus, and brachioradialis. The median nerve and ulnar nerve travels to the forearm without innervating arm muscles. That's it. Now you've learned basic anatomy of the human arm. Be proud. And that's all for this video. I hope I haven't scared you away yet. If you're interested in anatomy, I wish you good luck and stay positive. Bye.